I'm very impressed with my fellow panelists, and I have some advice for the entrepreneurs in the audience. If you want to get into healthcare IT, it helps to have a reason to do this. This is not the easiest way to make money in the world. It's not even the easiest way to bring change in the world. But I thought I'd share a little bit of my own story, and it's what I remind myself of when we hit some of the inevitable obstacles that you've heard about for the past 2 days. So I'm going to talk a lot about myself, a little bit about our company, Axial Exchange. We are in Raleigh, North Carolina. We are a Mayo Clinic portfolio company, by the way. And we are in the business of connecting patients, building smarter patients and smarter doctors to deal with the chronic healthcare problems in this country. And you'll see how we do that in a little bit. Okay, I don't actually have a picture of me when I was the most sick. I went back through my archives and couldn't find one. There was a 2-year period. I did not let myself get my pictures taken. This is a year well. So that was about 8 years ago. My hair is beginning to grow back. I'm still a bit emaciated. My smile is still forced. And the clock worked backwards as I got better. That was last year. You can see my child grew up in that period. She's now a freshman at Duke University. I'm happy to say I've regained most of my health. I still have bad days from time to time, but it has been an amazing journey back. So for the doctors out there, these were some of my symptoms, and I wanted to use a 60-point font for fatigue. I should say before I got ill, I was type A overachiever. At the time when I really plunged into illness, I was the COO of Red Hat, which was a great growth story in the tech market in the last decade. And really going strong as I had. It wasn't my first startup. And it wasn't a startup by the time I came along, but it was a shock to me to find myself immobilized. I really had never experienced that before. And some of the scarier things were having my limbs go numb, headaches that would be so bad that I would faint, and I would, when I would come to, my heart would pound for 24 hours afterwards. I would be so allergic. I was reminded this is sitting there today. Somebody had on aftershave. When I was at my sickest, that could cause me to faint. And, it still gives me a headache, but not the same. So here's my journey by the numbers. I went to 10 doctors before I got diagnosed. It took 2 years for my first part of my diagnosis, and it was 5 years before I ultimately got what I believe to be the complete diagnosis. And I got 10 different diagnoses along the way. And my story is not atypical at all. In my own family, my brother was diagnosed with liver cancer by the time it was over 88% of his liver. My mother went 2 years coughing up blood before she was diagnosed with a cousin of tuberculosis at a major health center. I'm still not sure why they didn't figure it out. Since I started the company, my daughter took 6 years. I watched her go from a healthy, happy child to one that lay depressed in a fetal position. There's not a lot that's changed, but it gives me a lot of reason why we do things. So these were the 10 diagnoses with the 3 circled that actually turned out to be right. I found out that, in fact, I have a very uncommon configuration. The Lyme's and the fibro go together, the fungal infection not so much. But it was actually the Lyme's that got diagnosed last, and I really do think it was causal for a lot of the other issues that I had. And it's a disease that is poorly understood. There's academic fighting about it, and essentially what I'll tell you is the longer you've had it before you get diagnosed, the harder it is to find any workable solution. And so I probably had it for about 10 years before I was diagnosed. And since then, it's turned out that both my husband and my younger daughter also have been diagnosed with Lyme's disease. So it was when I had to leave work. I had to leave a very good job at Red Hat to try and find out what was wrong with me. And the first diagnosis I got was my fibromyalgia. And this was before there was, quote unquote, a blockbuster drug for it that helps 19% of the people some of the time. But that's why you may have all heard about fibromyalgia. Before that, you really couldn't find out anything about it. And I thought that was my issue, and I dealt with a lot of the symptoms. But I just kept having one neurological problem after another. And my 10th doctor, who's the one I stuck with, kept saying to me, there's something else wrong with you. I want to test you for Lyme's. I'd be like, I don't have Lyme's. I am the anti-Lyme's candidate. I'm not out backpacking, et cetera, et cetera. But in fact, I did. And so this little bug gave me this little bacteria. And by the way, the thing everybody needs to know about Lyme's is that if you see that tick, it's probably not the one that's going to hurt you. The ticks that are infected are in their nymph stage. And if they ever come up with a vaccine, it will be because in my opinion, it will be because they understand what happens in a tick's life cycle, why they don't become contagious during their own life. But this bacteria wraps around your nerve endings, in essence. It crosses the blood-brain barrier, and if you go years without getting it diagnosed, it can be very, very harmful. So, as I was recovering, and in the first year of my recovery, my fungal infection was so bad I was no longer absorbing vitamins and minerals. So I spent, not Jessica's kind of rehab, but I spent 3 days a week with IV in my arm, 3 hours a day getting vitamins and minerals so I could get my strength back. And I started thinking about, what could I do? I was a technologist, I was a business person, I wasn't a doctor. And it became pretty obvious to me that one of the root cause problems was this inability to share clinical information from point A to point B in an inexpensive fashion. So Axial 1.0 was, in fact, an open source, with my open source roots, open source engine for sharing clinical information. And for all the entrepreneurs out there, sounds great, terrible business model. Just because it worked for operating systems doesn't mean it works in healthcare. But from the root of that came Axial, which was, well, what do you do with that data? If you can share it, what do you do with that data? And what's become obvious, I think, to all of us is that we're a nation of chronic disease. But if you think about all the money that's going into healthcare and health tech, it's focused on that 0.1% of the time that you're with a healthcare professional. And what we do is we provide a high-resolution snapshot of the patient. We give them self-care and tracking so that they can get better. We help them with medication management and education. And these are really sort of the 3 pillars of self-help in our belief. But then the other side is we want to have smarter physicians. So instead of having a conversation with a chronically ill patient, a diabetic, about, well, how have you been? I've had my good days and my bad days. Instead, you ought to be able to share exactly how you've been in a very simple format in their workflow. So we integrate with population management, EHRs, and care coordination systems. So the first thing is, what do I need to know? As we all know, the internet is full of mostly garbage and some jewels underneath. And that's really dangerous in the healthcare situation. So one of the things we wanted to make sure is that everybody had good information, and this is where Mayo comes into the picture. We have access to the Mayo Clinic library, and parsed for the smartphones and mobile devices, and it's over 2,000 conditions. And I should mention our business model is that we sell to healthcare institutions, and they in turn give it to their patients. So that was one of the problems that physicians always complain about. Yeah, people come in here with something they pulled from the internet, and yet it didn't seem like they were doing the obviously simple thing is, well, why don't you give them good information? So we do that. As well as, I'm not going to do a full product pitch, but we also do continuing education as well. Okay, actually, my daughter took this picture because I forgot to take the picture before I left home, but this is actually half of my weekly medications, and you get some idea of the complexity, and this is my pill box, so the question becomes, how do I make sure I'm taking the right meds? And I'm, relatively with it compared to my mother, but she's got the same problem. So one of the things we do is we have a visual pill box. So I can take, and this is really important because when you're on chronic meds, I go to the same drugstore every month. They give me a different pill for the same pill every month. So how do I know that I'm taking the right thing? So we're able to put together visual pill boxes. It's also it looks like an app, but it's really a complex application. It's a network, so I can set up my mother's pill box, and then she gets the reminder. So we deal with that. How do I discuss the symptoms with my doctors? Instead of just saying that I have headaches, where were they? What caused them? How long were they? And if you download one of our apps, you'll see that essentially anything you would want to measure for chronic disease, you can do the symptoms. And then what should I do? So I actually, in tracking my headaches, found that travel, which I do a lot of, is my lead cause of headaches. Which you'd think I'd know that, but until you track it, you don't really know it. We are integrated with over 115 devices, so everything from digital scales, blood pressure meters, etc. So the reality is that goes over really well in this crowd. In most of the country, they just want to put it in. But in addition to having the information that you can share with your healthcare provider, the important thing is you want to annotate what was happening when you were out of range. That's really what the physicians want to know. And that's what you should want to know so that you can help make yourself a better patient. So we're proud to say that we're having some good success. These are some of our clients. We've got, these are some really big health systems. We have over 70 hospitals. Thousands of patients are now using the application. And in our next phase, we're about to sign our first client that integrates all this patient-generated information back into their care management. To my knowledge, they will be the first. We hear a lot of talk at these conferences. I'm hoping somebody can prove me wrong, but so far nobody's proved me wrong. I think they will be one of the first major systems to use patient-generated data to do real-time case management. So they will use it to monitor their heart patients after leaving the hospital and really their high-risk patients. So we're very, very excited that our clients are beginning to really understand the benefit of this. So I stand here really with the make lemons from lemonade. This wasn't what I was planning to do. I was into open source and code, but now every day when I go to work, I feel like we're beginning to change the face of healthcare for the better. So thank you.